as an agency to get this information to your folks. So assuming everybody can see the screen, and I'm going to be taking us through a slide deck. So I just want to first context this presentation that this is really a sort of a 101 presentation. There's obviously going to be a lot more nuances to the law than what I have the time to go over today. But I want to make sure my goal is at the end of this is that you walk away having a much clearer picture of how the ACA is going to affect small businesses and you in your everyday life. So I also want to just point out it's really important that you take to heart that red sentence that's put up there on the screen. This is definitely not any legal or tax advice to you, so please make sure that you are consulting with your specific advisors for your situation. All right, so let's get started. Okay, so first, the National Federation of Independent Businesses, which is a trade organization for businesses, has been taking polls of their members for a number of years. And since 1986, they've found that the #1 concern for small business owners has actually been access to affordable health care. And one of the reasons for that is because of I'm sure you've heard about this, you might experience this yourself, is the fact that the small businesses have a much smaller risk pool, and so they have a more difficult time actually being able to purchase insurance for their employees at a lower premium cost. And generally, they'll actually pay, on average, about 18% more than their big business counterparts for sometimes some of the same insurance coverage. So let's talk a little bit about how the Affordable Care Act, also known as the ACA, reduces premium costs and also increases access to this affordable care. You know, prior to the ACA, I just talked a little bit about this, but small employers really face a lot of obstacles. There weren't enough choices. You know, the smaller your company is, the harder it is to find an insurance company that's willing to provide coverage for you. Your premiums were a lot higher. Your rates would, you know, unpredictably increase. And also, groups of certain demographics are able to be discriminated against in terms of pricing. So women, older workers, people with chronic health concerns, pre-existing conditions would have a hard time actually getting coverage if they were able to get coverage at all. And so the Affordable Care Act was actually created to sort of stop some of those issues. Not least of which, I'm sure some of you have heard of this, which is the 80-20 rule, which basically says that insurance companies, if they charge for premiums and they're paying for coverage for folks, 80% of those dollars that the coverage pays for have to go to direct care, and they can't spend more than 20% of those dollars on administrative costs. The other provision that I think actually is going to have a pretty big impact is that at this point, insurance companies, if they want to propose hiking their rates by 10% or more, they have to actually disclose that, and they have to justify publicly why they need to actually increase those rates. Now, starting in 2014, they're not going to be able to deny coverage because of a pre-existing condition. They're no longer going to be able to discriminate based off gender. And there's going to be the opportunity for small businesses to actually pool their risks together so they can actually create a larger risk pool, which will then drive down premium costs. The other really important part of the Affordable Care Act is that there has been, HHS put together a list of essential health benefits, which essentially means that there are 10 minimum health benefits that insurance companies must offer if they're going to be in compliance with the ACA. And you can find a lot of that information on HHS's website, which is just healthcare.gov. And I also actually, I probably should have said this in the beginning, but I just want to let you guys kind of know what the Small Business Administration's role is in the ACA. We're in this interesting position because we're not actually a regulating agency. We didn't write the law. We don't really have anything to do with how it was created, and we don't write the regulations as well. However, it is absolutely our job to make sure that we're able to get the information on how this law will impact small businesses into the hands of business owners. So that is why we are doing our absolute best to try to get out there and get this information to as many people as possible. Okay, so let's talk a little bit more about how the premium cost growth increases to access to affordable care. There's a couple of things, two major things, and we're going to get into this in a little bit more detail. But one is that there's now been created a small business healthcare tax credit, so that since 2010, there's actually been an opportunity for small businesses to get a credit of up to 35% of their premium contribution to pay for the health insurance for their employees. And now remember, that's a tax credit, so the money that they spent beyond that credit, they were actually able to deduct as a business deduction as well. And so you have tax credits that are now available. And the second major thing is the opening of the new health insurance marketplaces. And those aren't going to be launching until January 1st of 2014. Okay, I'm not sure I want to spend too much time on this slide, but we can go through it somewhat. And I think, Dane, if you guys want to send out, I believe that we sent you a PDF version of this presentation, and it's definitely okay for you guys to make that available to your members or for folks who are on this webinar. So that way you don't feel like you have to diligently write notes while I'm talking. A little bit about this. I think one of the major things that most people I think have heard of is the young adults having coverage through their parents' plans, and that's that rule that actually began to be implemented this past year, where young adults, so children up to the age of 26, can now be covered on their parents' health insurance plan, which has definitely helped. There's about 3.1 million who were previously uninsured who are now actually covered through this. And so so on their 26th birthday is when they're going to be kicked off the plan, but they'll be covered all the way up through then. And now you can't drop people that are insured. It used to be the industry practice that a health insurance company would cover you until you actually needed it. So as soon as you got sick, they were able to kick you off. And now through the ACA, with the provisions that have been put in place, they're no longer allowed to do that. And another big part of this is the electronic records reform, which is really trying to move all of the health care into an electronic format so that if you change doctors, there's a much easier way to communicate between the two practitioners for when you switch. Okay, so now we're going to get into the meat of how this affects business owners. So, we get asked the question a lot, how is the ACA going to impact my business? And really the answer is, how many people work for you and how much do you pay them? And really the biggest trigger is the number of employees that you have. And you can see we split this off into 4 different categories. There's really 5 categories that's not on here. The other one is being self-employed, because obviously that is also a business. But in each of these, 10 or fewer, 11 to 24, 25 to 49, and 50 and above, those are the different categories in terms of how you are impacted by the ACA. Okay, so let's talk a little bit about the small business healthcare tax credit. And the reason I want to talk about this now is that we're going to be focusing on businesses with 10 or fewer employees and businesses with 11 to 24 employees. So these 2 slides are going to be affected by the small business healthcare tax credit. And the reason why is that it's really been, this tax credit was created as a way to really help out those small businesses that employ a small amount of employees and then also tend to employ lower wage employees. So it phases in and out. But if you have a business and you have 10 or fewer full-time employees and you pay an average wage of $25,000 or less a year to each of those employees, you will be able to generally qualify for the full amount of this tax credit. And I mentioned it a little bit before in a prior slide that it was 35% starting in 2010. And that's really between 2010 and 2013, this small business healthcare tax credit was for 35%. And starting in 2014 and going into 2015 and beyond, it's going to be up to 50% of the employer's coverage of the premium for their employees. So again, if you have 10 or fewer and you pay less than $25,000 in wages to them on average, you're generally going to qualify for the maximum tax credit for this if you offer health insurance. But I do want to make sure that you understand as well that if you have 10 or fewer employees, there's generally no requirement to offer coverage. You do not have to do this, and you don't have to worry about the employer shared responsibility provisions, which we'll get into next in a few slides. But if you choose to offer it, there is tax credits available for you. And again, this is a federal tax credit. There might be state tax credits as well, but that would really obviously depend on which state you're in. Okay, 11 to 24, and the reason I split these out in this presentation is that, again, this tax credit phases in and out. So as you increase the number of employees you have, the less and less of a credit you're going to be able to qualify for. So in order to get under it and you'll be able to qualify for at least part of that tax credit is if you employ fewer than 25 employees, so that means up to 24, you pay an average annual wage of below $50,000 or below, and you contribute 50% or more towards the employee's premium costs. So once you go over that average salary of $50,000 or go above 24 full-time employees, you will slide completely out of that tax credit availability. And again, this is just a slide that sort of gives you more in like a bullet point fashion of what I was just saying. Again, it's 35% for the years 2010 to 2013. And you can deduct the remainder of the contribution that you pay. Starting in 2014, the credit goes up to 50%. The only caveat to that is that since the insurance marketplaces will now have been launched at that point, in order to qualify for this credit, another part comes in where you have to purchase the insurance for your employees through those insurance marketplaces, also known as the shop. Again, another just a graphic for this. We're trying to make it as easy as possible, depending on whether someone's a visual learner or not. So fewer than 25 full-time equivalent employees, average annual wages are less than $50,000, and if as a business you pay for at least 50% of your employees' self-only premium costs, you'll be able to qualify for that credit. Okay, so now going into between 25 and 49 full-time employees, again, there is no requirement to offer health coverage, and there's no, you're not going to be covered by the employer shared responsibility provisions. However, if you decide to offer insurance to your employees, you can obviously take that as a business deduction, but there are no tax credits available to you, at least on the federal level. And again, just to reiterate, depending on your state, there might be tax credits available on the state level. All right, so let's just recap this. And again, we're grouping this category generally as small businesses that have fewer than 50 full-time employees. Again, generally no requirement to offer health insurance, and you're not going to be covered by the employer shared responsibility provisions. If you choose to actually offer health insurance to your employees, you are probably eligible for the small business health care tax credit. And starting in January 2014, again, if you choose to offer coverage, even though there's no requirement to do so, you can purchase through the Small Business Health Options Program, also known as the SHOP, also known as the insurance marketplaces for business owners. Okay, so let's talk a little bit about those health insurance marketplaces, also known as the SHOP. They start January 1st of 2014. And I also just want to stop here and say, just really quickly, if there's two things that you remember from this whole presentation, it would be the date of January 1st, 2014, because that's when almost all of the provisions are fully implemented in this law. And it would be the number 50, because the magic number for full-time employees is the number 50. And once you reach that, you will then be covered by the employer shared responsibility provisions, which we're going to get to in a few slides. But first, let's talk about the marketplaces, because these are going to be available to small businesses that have 50 or fewer full-time employees. You may have also heard these called exchanges. They sort of went back and forth on their names for this. But essentially what it is, if I'm an insurance company and I want to offer insurance to the small businesses in a certain state, I need to be able to, I have to offer the 10 essential health benefits, and that's what it is for the insurance company. And then as an employer, as a small business owner, as you're going in there to look for health insurance, first of all, you're going to be able to pool your risks together with other small businesses. So it's not just you and your 10 employees. It's you and your 10 employees, and then the other business down the street and that person's 10 employees, and so on. So you're going to be able to increase the risk pool, which will naturally just drive down the premium costs. And the other great thing from a user perspective as a business owner is that you're going to be able to go onto this thing and just send one check to the insurance exchange, and they're going to then take it and give it to the insurance companies that are offering the insurance to your employees. Okay, so let's talk a little bit about what you can do as a small employer. You can offer choice of different qualified health plans through different private health insurers to your employees. You get to decide which health plans you're going to make available. You also get to decide how much you're going to contribute toward premium costs. And in order to qualify for the tax credit as a small employer, you're going to need to be able to contribute at least 50%. But for those of you, in particular, the employers that have anywhere from 25 to 49 full-time employees, you're not able to qualify for that tax credit anyway, so you don't have to actually contribute 50%. You could contribute less than that. You can collect your premiums through payroll deduction, through pre-tax dollars. You get one monthly bill. You make one monthly payment to shop, which will definitely help in terms of administrative costs as an employer. Now, I want to definitely make sure that we talk about the second bullet point where it says decide which qualified health plans to make available to employees. Now, the reason I want to talk about this is this is a rule, and some of you may have heard about this, but maybe you haven't. I'm going to assume you haven't. This choice that the ACA is trying to offer, this is actually going to be phased in. So this bullet point here is actually it's going to be for every state starting in 2015. But for the year 2014, some states are going to allow business owners to offer different plans to their employees and allow employees to choose. But some of this rule has actually been is going to be phased into 2015. So what this means, I'm going to talk about this as if it's 2015, because this is how it's going to be for the rest of time once it kicks in entirely. So the way these insurance exchanges are going to work is that insurance companies are going to have different metal levels in terms of what they offer for coverage. So you'll have a platinum level, you'll have a gold level, you'll have a silver, and you'll have a bronze. And in descending order, it basically is, if you have a platinum level insurance plan, 90% of the costs will be covered when you go to the doctor. So if you went to go see a doctor and the visit was $100, you would only have to pay $10 out of pocket as the patient. And then the gold level would be 80% coverage, silver level would be 70, and bronze would be 60. The way that this choice will work is that as a small business, I will go onto the shop and I'll decide I am going to purchase and contribute whatever it is I'm deciding to contribute to offer to my employees, the silver level of all insurance plans. So the employee will then log on to the shop and say, okay, my employer is offering to cover for the silver level of insurance. I get to then go onto the silver plans and look through all the different insurance companies that are offering silver plans, and I can choose whichever insurance company I want on their silver plan level. So that means you as an employee get to choose which insurance company you want. And then you as the employer, what's great about this is that you still, again, you make one monthly payment. So even if all 10 of your employees decide to work with 10 different insurance companies, you're still only making one check. You're just making one monthly payment to the shop. So that's how that's going to work. And then for this first year, for 2014, it's going to be a lot like how it's always been, which you as the employer go on and you choose which company you're going to use, and that's what your employees get. Okay, so who, when, and how do you enroll in SHOP? So generally businesses with 50 or fewer employees, Some states are going to allow up to 100, but I think the general rule right now, most states are 50 or fewer. Businesses can go onto the shop and actually purchase insurance through there for their employees. Starting in 2016, employers with up to 100 are going to be eligible to participate, and then beyond that, the regulations allow states to increase it, but they're allowed to do it. Doesn't necessarily mean that they will do it. And then once you enroll in SHOP, but if you grow, if you add more employees, you're still eligible to remain. So if you have fewer than 50 employees starting in 2014, but let's say you have a boom year and you're able to hire another 25, obviously you're above 50 at that point. Because you've already enrolled in SHOP, you're allowed to remain in it. You won't get kicked out. Now, when can you actually enroll? Enrollment is going to start October 1st of 2013. So coming this October, you're going to be able to go online, look at healthcare.gov. You can see that website there, and you'll be able to start enrolling with coverage beginning January 1st. And then throughout the year, it's going to be on a monthly basis after that in terms of enrollment periods. And again, if I'm telling you all this and you don't really care as an employer and you don't want to deal with it, you can always use your broker. You can go on as a business owner and just figure out all this stuff on your own through healthcare.gov or whatever state. If your state has a different website for it, you can go on there and log on. But you can also choose to just use a broker. You don't have to deal with it on your own. Okay, so let's talk a little bit about the employer shared responsibility provisions for health insurance coverage. Now this, I will tell you, this is the official name for this, but this is what a lot of folks would refer to as the penalty that folks need to pay, or the tax for not offering health insurance. So these rules will kick in January 1st of 2014. And again, it only affects businesses with 50 or more full-time employees. And this, I think this is an important slide because you hear a lot of people talking about how a lot of businesses are going to have trouble with these provisions. And the real deal is that 96% of all firms in the U.S. actually are not covered by these provisions at all. And quite frankly, most of the firms that are covered by these provisions already are offering health insurance to their employees. All right, so again, the number 50, full-time employees. That is the magic number, is 50. So I want to go into a little bit of a nuance in terms of the definitions that I've just been using about full-time employee. Because the way that the provisions are written is actually a little more nuanced than just full-time. So you can see on the screen right now, the definition of a full-time employee, it might not necessarily be the layman's definition, but this is the definition according to the employer shared responsibility provisions within the ACA. It's someone who works on average 30 hours or more per week. And then you have the definition of something that's called a full-time equivalent employee. And what that means is someone who actually works full-time, so someone who works 30 hours per week or more on average, or it's a combination of two part-time employees added together equaling one full-time employee. So just to go back again, right here, 50 and above, the businesses with 50 or more FTE employees, what that actually means is businesses with 50 or more full-time equivalent employees. So that means that you would hit that number 50 if you have 50 people who work for you that work an average of 30 hours or more a week, so they're actually full-time employees. Or that you would hit this number 50 if you have 100 people who are all part-time workers, but if you add the two part-time workers together, you end up getting 50 full-time equivalent employees. So I just wanted to make sure you knew that. So real quick, what does that mean then if you're looking at that? Let's say you have 100 people that work for you and they're all part-time employees. None of them actually work full-time. But you add them together and it equals 50 full-time equivalent. So technically, you are covered by the employer shared responsibility provisions in this law, which means that you offer, your choices are to offer health insurance to your employees or pay an employer shared responsibility payment. However, if you don't actually have any full-time employees, you don't actually have to make that payment because it's you're only required to offer insurance to your actual full-time employees. It can get a little tricky. I know that there might be a lot of questions on that, and I'm more than happy to go over different examples, or we can talk about that rule in more depth when we get to the Q&A section. All right, so let's move forward. Okay, so here, this is the rule in a nutshell. If you hit that magic number 50 of having 50 full-time equivalent employees or 50 actual full-time employees, you can either offer insurance to at least 95% of your full-time employees and their dependents, or sorry, let me redo this. If you meet this 50 number threshold, this is what will trigger your potentially paying the shared responsibility payment. You either don't offer insurance to your full-time employees and their dependents, or you do offer it, and the coverage that you offer is not actually affordable or doesn't provide the minimum value, and at least one of your full-time employees goes out and receives a premium tax credit in the individual marketplace, which I told you there's some tax credits that have come into play with this new law. Not only do businesses have the ability to have tax credits, but individuals do as well. There are certain levels in terms of your annual wages. It's linked to the federal poverty line, but whether you can qualify for it or not. But essentially, if you have 50 employees, if you do not offer coverage to at least 95% of your full-time employees and their dependents, again, actual full-time employees, or you offer it and it's not affordable, and at least one of your full-time employees receives a tax credit on the individual level, you're going to have to pay that shared responsibility payment. Okay, so let's talk a little bit about what does minimum value mean and what does affordability mean. So minimum value essentially means that when I go to the doctor, if it costs $100, I can't pay more than $40 out of pocket. So essentially, the plan has to cover 60% of the actual medical costs when I'm seeing a doctor. And HHS is developing a calculator for this so that as an employer, you can go on to HHS's website. It's not finished yet, but you'll be able to figure out whether or not the plan you're purchasing is going to meet that 60% threshold. Now, what's the definition of affordable? There's 3 safe harbors, actually, that employers can use, but the easiest one is that coverage is deemed unaffordable if the employee's share of their premium costs is more than 9.5% of his or her annual income, his or her annual household income. So obviously that raises the question, how am I supposed to know what my employee's annual household income is? I don't know if it's 9.5% or not. So there's a safe harbor that's been created, which is essentially is if, as the employer, if you can show on box 1 of the W-2 for your employee that the contribution they make is less than 9.5% of his or her actual wages, then you have cleared the affordability provision for this rule. So again, as long as you can show that what your employee contributed towards their premium cost was less than 9.5% of their annual wages, even if it's actually more than 9.5% of their household income, you'll be in a safe harbor zone for that. Okay. So let's look at the 2 different scenarios here. And I understand that a lot of this is just a lot of words coming at you. And again, please feel free to ask me questions at the end to sort of clarify this. So the box on the left there on your screen, this is a situation where you decide not to offer insurance to your full-time employees. So you have more than 50 full-time equivalent employees, and according to this rule, you either offer that coverage or you pay this responsibility provision. You've decided, you know what, I'm not going to offer it. So this is the risk in terms of the potential payment you would have to make. It would be $2,000 a year per full-time employee. And you'll see it's above 30, because what it means is that the first 30 of your actual full-time employees are exempt from this rule. So let me give you an example of what that means. What that means, let's say you have, just to make the math simple, let's say you have 50 actual full-time employees that work for you. You decide, you know what, I'm just not going to offer the insurance to anybody. I don't care. I'm risking making the payment. Let's say one of your employees goes out there, and let's say it's just one employee. They go out and they end up purchasing insurance on their own in the marketplace, and they end up actually getting a tax credit. And so they get that tax credit. What that triggers for you as the employer is now you have to pay $2,000 a year for each of your employees after the first 30 because that person went out and got that tax credit. So what that means practically is that if you have 50 full-time employees, you would minus the first 30, so you would pay $2,000 for 20 of your employees per year. So that's a $40,000 payment. And again, remember, this is not tax deductible. This is just a full payment for this. Whereas if you offer health insurance to your employees, that whatever you pay towards the premium is a valid business deduction. All right, so that's the first situation where you decide not to offer. Now, let's say in the second scenario, you decide to offer insurance to your full-time employees, but it's either not affordable or it doesn't meet minimum value. So again, not affordable means they paid more than 9.5% above their annual wages. And then in terms of not meeting minimum value, it means when they go to the doctor, they pay more than $40 out of pocket for whatever $100, whatever their cost is for that. Okay, so payment owed. It'd be $3,000 a year per full-time employee who actually receives a tax credit in the marketplace. Meaning, in that first scenario where you don't offer it at all, if even one person gets it, you make the payment for everybody. In this scenario, because you had good faith and you tried to offer health insurance, if someone gets a tax credit, you only pay that $3,000 per year for that actual employee who goes out and gets the tax credit. So if it's only one person, you only pay it once. Now, I'm using those numbers 2,000 and 3,000 because it's just easy mathematically, but this is calculated on a monthly basis. So if you don't cover for 3 months, you'd pay the prorated amount. So it would be 166.67 times 3, and then 250 times 3 in the second scenario. Okay, so just additional points. You do not have to make any payment if you do not cover part-time employees. It's only required for the full-time employees. If your employee decides not to take the insurance, even though you offer it, you're not going to be liable for that employee. And then I know that also raises the question, okay, how is the IRS going to find out that I actually offered this insurance to my employee and they declined it? I can't speak to the IRS because I don't work for them, but I do know that the IRS and the Social Security Administration and HHS and all these agencies that are involved in this are working together right now to figure out a way so that it's easily reported to the employer, to the employee, to the regulating agencies that you offered it, that they declined it, and that is definitely a system that's being created right now. And again, there's no payment owed if an employee gets insurance through something other than the insurance marketplace. So I offer it to an employee, they don't take it, and it's because they're married and their spouse has insurance that they're covered on. Okay. Next slide. So let's look at some of the incentives for employers to offer coverage. Again, I've already said this, but providing coverage is tax deductible. Paying the shared responsibility payment is not deductible. And again, you're actually going to be able to use this insurance coverage as a way to recruit top talent. For folks coming up in this economy, there's a lot of talent out there looking for jobs, and this is one of the ways that you're going to be able to recruit people to work for you. All right, so let's talk a little bit about the self-employed business owners and health insurance coverage. Now, starting in 2014, we talked a little bit about the employer shared responsibility provisions, but there's also the individual shared responsibility provisions, which essentially means that you as an individual need to have health insurance as well, or you risk paying the individual shared responsibility provision. So this counts for self-employed people as well. And you need to have the minimum essential coverage, which is the same as everybody else. This includes employer-sponsored, retirees. If you're on Medicare, that would obviously count. If you purchase as an individual on the insurance exchanges, that would count. VA coverage, TRICARE, those are all different examples of the minimum essential coverage. Now, in terms of if you're a self-employed business owner, you will actually not be purchasing your insurance through the SHOP, which is the Small Business Health Options Program. You will be you'll actually be purchasing it through the health insurance marketplaces for individuals. I'm not, again, I don't work for HHS, so I'm not sure why they split it off that way, but the SHOP is for small employers purchasing insurance for their company and their employees. And the individual marketplaces is for individuals and self-employed business owners. And again, those are going to be opening in October 1st of 2013 to start enrolling, with coverage starting in January of 2014. And those tax credits are available to you as an individual. Now, this is just a few things that employers are going to need to know about. You're going to have to give a summary of benefits and coverage disclosures to your employees. You have to give them information on that. You're going to have rebates on medical loss ratios. You're going to actually have to report health care costs on your W-2s. However, if you file fewer than 250 W-2s, you're actually exempt from that rule. And then the annual tax-deductible cap for employee contributions to flexible spending accounts is $2,500. So you just need to make sure that your administrators in your business are taking a look at that, making sure that doesn't surpass that. And then so looking forward, beginning in 2014, there's going to be a 90-day maximum waiting period for new hires in terms of offering insurance to them. There's also going to be some financial incentives and rewards for creating wellness programs where you're actually going to be able to lower the premium cost for the insurance that you purchase. And then with employers with 50 or more full-time employees, you're going to have some more reporting requirements on health insurance coverage offered, which is that ties into the whole that system that IRS and the Social Security Administration, et cetera, are working together to figure out. All right, and then this is my last slide. I just want to hang this up here. These are some great resources for you to take a look at in terms of finding out more information. I know that all of these websites offer, frequently asked questions. They have fact sheets. They have presentations that you can take a look at. And I just think that there's a wealth of information on these. So I just wanted to show those websites to you guys. And with that, let's open it up to questions. I hope that I've been clear, but if I haven't, please ask away.
Thank you very much, Julie. This is Dane Hansen again with the IAPMO Group. So as stated at the beginning, we will move through questions. So if you have a question, click on the icon on your screen and to have your hand raised. And in doing so, Alan in our headquarters will unmute you and state your name so you can ask your question. I believe we have one, so feel free to move forward, Alan.
Okay, Jay Thomas. You're able to speak?
Jay Thomas, are you there? Okay, well, we can move. It sounds like he's not there. We do have a written question, so I know we have a couple there that we can go through. It says I don't know which slide he was talking about. It said the last slide, but this was provided early on in the presentation. It says, so it's probably the first few slides. It says this one slide talks about a $50,000 average wage and $25,000 under the note.
Yep.
What is the difference? Is that an error?
Not an error. I think this is the right here. I think it's this slide and this slide that the person was talking about. So in this slide, I was talking a little bit about the small business healthcare tax credit. And so this tax credit is available to employers that, again, it's a phased out tax credit. So in order to qualify for this tax credit, you have to employ fewer than 50 full-time employees and pay average annual salary of $50,000 or less. So if you have 24 full-time employees and you pay an average of $50,000 in annual wages to these folks, and you offer health insurance, you're going to qualify for the tax credit, but you're not going to qualify for the maximum tax credit. So the reason I put that $25,000 up there in terms of wages is that I wanted to show you a scenario where if I'm an employer, this is how I can qualify for the maximum tax credit. So if I employ 10 or fewer full-time equivalent employees and I pay an average wage of less than $25,000 to each of those employees, I will be able to qualify for the full tax credit. So for the years 2010 to 2013, 35%, and then for 2014 and beyond, it would be 50%. Does that? I hope that that's clear in terms of an answer.
Great. Yeah. Thank you. I appreciate that. I think there's another hand raised. Alan?
Yeah, Diane McKinney, you're on.
Yes. I would like to know about this. We're an S Corp and wanted to know if this credit is passed down to the shareholders, and if so, if the shareholder has more than one S Corp, is a tax credit for each S Corp being able to pass down, or only one?
Okay, great question. I am going to go to the very first slide, which is that. I do not feel comfortable answering very specific individual questions because I don't have all of your facts right in front of me, and I would need to be able to see all that before answering that question. I'm sorry that I can't give you a more definitive answer than that.
Thank you.
Yep.
Yeah, and just to specify like we did at the beginning, yeah, we can't, of course, give out tax advice in specifics, so that's why this is a guide and to ask questions in general. Do we have any other questions there?
Yeah, looks like we got Jay McKinney again. Jay Thomas, you're on. Mr. Thomas, Mrs. Thomas.
Okay, we'll move on to the next. This is from Cindy Turner. She says, I was under the impression that all businesses were required to offer insurance if the employee reaches 30 hours of work.
I hope that I didn't give that impression.
I think that was said, a question was asked early on in the presentation, so I don't think you said that. I think she was just saying what her impressions were.
Gotcha. Okay, so let's look at this slide right here. Starting with the top. 10 or fewer do not need to offer insurance at all. 11, let me start off by saying this law does not require people to offer insurance. You're making the choice of either offering insurance to your full-time employees or potentially paying the employer shared responsibility payment, which only kicks in once you hit that magic number of 50 or more full-time equivalent employees. So if you have fewer than 50 full-time equivalent employees, this law basically doesn't apply to you in terms of the employer shared responsibility provisions. So if you have 50 or more full-time equivalent employees, at that point, that is when you must offer insurance to your employees that work 30 or more hours a week, or potentially pay the employer shared responsibility payment. Anything, if you have fewer than 50 employees and full-time equivalent employees, those paying that payment is not applicable to you.
Great.
I hope that that's clear.
Perfect. Thank you.
Okay. Yep.
And again, everyone, if you have questions, please raise your hand. I think we have another one now, Alan.
Yes, Jordan Hardy, you're on.
All right, can you hear me? Sorry, can you hear my question?
Yes, I can hear you great.
Okay, excellent. Our company's part of, they're called PEOs. I'm not sure what that actually means, but it's a conglomerate of companies that's already pooled together. How does that work? Because we actually don't file or do anything with the IRS. That's all done through our PEO. Are you familiar with that, and how does that work with this law?
I'm not entirely familiar with that, but what I can tell you is that there are some control group rules that come into play. These are long-standing IRS rules, which it sounds like your company in particular, it sounds like it falls under that, but I'm not, obviously can't answer definitively. But essentially what that means is that if you, here, I'll just say it by example. Let's say you're a corporation your Corporation A, and Corporation A has 0 employees, but you own Corporation B, C, and D, and all of them have employees, you would actually add all of those together and you'd be considered a controlled group. So then each of those corporations would fall under the employer shared responsibility provisions if, when added all together, B, C, and D equal more than 50 full-time equivalent employees.
Yeah, that's exactly actually the question. I've got one more if that's okay.
Sure.
We actually cover 100% of our employees. We're less than 25 employees. We cover 100% of their premiums actually. Is there any benefit to offering really good benefits to the employees with this new law?
Other than you're going to be able to recruit a lot of talent, if you have fewer than 25 full-time employees and you're offering insurance, you can qualify for that tax credit that I was referring to, as long as your wages are $50,000 or less.
They're a lot higher than that. So
they're a lot higher than that.
Yeah, so we wouldn't qualify for that if you go above the 50. Correct.
Then I would say, other than just being able to write it off as a general business deduction, and then also the ability to recruit really great talent, that's not really, the law does not have any other incentives besides that.
I apologize. Can I ask one more question?
Sure.
You got me muted. So I looked at our PEO. What that means is that all of our employees are actually not employees of our company. They're employees of a group called A Plus Benefits, which is what a PEO is.
Okay.
And so does that maybe help clarify what a PEO is, and then how do you still know how that would work or no? Sorry to push.
I don't know. It's fine. I'm sorry. I can't answer your question. I'm sorry for that.
Thank you. Appreciate it.
Yep.
Great. It looks like there's another question, Alan.
Alex Watkins, you on?
Yes. Hi, can you hear me?
Yes.
I was hoping you could talk about a minimum value requirement and whether you saw the article in the Wall Street Journal yesterday about offering the low-cost bare bones plans.
Yes.
Cost lower than the penalty.
Okay, so I did not see the article, but I can correct me if I'm wrong. I'm assuming the article is probably saying that if you create a minimum that requirement, that's what businesses are going to purchase. Is that what you mean?
That's one option for our business, yeah, to get around. That would save almost $1,600 annually per employee.
Yes, and to be totally honest with you, that might be something that happens because of this law. We're not. I mean, all of these fears and these ideas of what's going to happen, it's all kind of conjecture right now. We don't know because a lot of these provisions haven't kicked in. They're not going to until 2014. However, I mean, we all live in reality here. So absolutely, from a business perspective, all of these things are business decisions. And you have to take a look at weighing, doing a cost-benefit analysis. If it's going to save me on the bottom line to offer the bare bones, I'll still be in compliance with the law, I might choose as a business to do that. However, you got the other side of it, whereas if you're concerned about recruiting top talent and you want to be able to offer a sizable benefit package for them, that's the other side of the whole coin that you have to take a look at. But yes, I think that there probably will, there probably will be businesses that say, okay, this is the minimum I need to meet, and so that's what I'm going to do. But I mean, I obviously can't speak to every business owner or everybody's business out there. But yeah, I'm sure that will happen as a result of this law. Does that answer your question?
Yeah, very well. Thank you.
No problem.
Really quick, it looks like we have a question from Cindy, and she has having trouble raising her hand. So I've unmuted Cindy Turner if she has a question.
Yeah, I have a few questions actually. For the small businesses, since we're going to be limited to a small group market, is the access or quality of coverage going to be compromised?
Well, what I can tell you is that if an insurance company wants to sell to the small group market through the shop, they have to actually offer it. They have to offer these minimum benefits. So that it shouldn't be compromised because there's minimum standards that have been created through the law.
Okay. Now, is there going to be like an insurance industry fee to start this up?
I know that the insurance companies do need to pay a certain fee as per the law. I'm not, to be totally honest with you, I've been more focused on the impact on the business community, so I haven't quite looked into in as much detail on how the insurance companies will be affected, but I do know that there's some sort of fee that they do need to pay. I just don't know what that number is.
Okay. Now I do have another question. Since we're required to cover, are we required to cover those dependents? You know, you said the 26 years old young adults. Are we required to cover them?
Well, it depends on your situation. How many employees do you have for your business?
We have 8.
You have 8
currently.
employees? Okay, you're not required to offer insurance to anybody.
Well, we do offer insurance, so that's not an issue. But usually we have about 10 employees right now. We're kind of short. So yeah, we have 8 currently. Now, I am curious to whether we have. What if the okay? So I'm kind of sidetracked.
You're saying that you need to be required to offer it. Insurance companies need to be able to allow parents to add their dependents onto their insurance plans.
Now, if that dependent, because we are talking about 26-year-old people here, almost 30 years old.
You know, it's below 26.
Their...
I just want to be really clear. It's below 26. So on my 26th birthday, I'm no longer covered. I'm kicked off. So it's up to the age of 25. Does that make sense? I just want to make sure.
Yeah, so you have a 25-year-old, let's say, and they are able to purchase their own insurance through a company. Then it's no longer through the company that they're employed for, so they don't need to be on their parents' coverage, right?
Well, no, I mean that's their own choice.
Okay. Now, if the employee purchases, I've seen that there was if an employee purchases their own.
Are you there?
Insurance, we may have a fee if they're to pay it.
So, as an employer, everybody, can you guys hear me?
Yeah, I can hear you.
Can you hear me?
It sounded like her phone was breaking in and out.
Okay. Okay, so what I think she was asking, and I'm hoping this is what she was asking and she can hear me.
Are you there?
Yeah, I'm here.
Yeah, I didn't hear you.
Okay, can you repeat that last question because I think you went out for a minute. You're talking about the fee?
So if the employee, yes, if the employee purchases their own insurance for their dependents, are we required to pay a fee? Because I know if they purchase their own insurance, we're required to pay a fee. But if they purchase their own, because we have a particular employee that we pay his insurance for, but we do not cover his 2 kids.
Yeah, so this is actually a weird nuance in the law, and I'm not quite sure why it was written like this, but this is how it was written. So let's see if we can get to that. Hold on. I want to make sure I get to the right. Okay. Let's look at this real quick. Okay, so if you are an employer, remember you have to hit that magic number 50. If you have 50 or more full-time equivalent employees. So if you have fewer than 50, none of what I'm saying to you applies to you at all, okay? But let's assume you have 50 full-time equivalent employees. You have to either offer coverage to at least 95% of your full-time employees and their dependents, or potentially pay this employer shared responsibility payment. That being said, if you offer it to your full-time employees and not their dependents, that payment is not going to be required. For some reason, even though it says that you have to offer the coverage, there's only a penalty if your employees go out and purchase the insurance, but not if their dependents do. It's really, really nuanced, and I'm sorry for that. But that's technically, yes, you are required to offer the insurance to 95, and the reason it's 95% is they're trying to allow for a margin of error in there. But it's 95% of your full-time employees and their dependents, or potentially pay that payment if one of them goes out to get the tax credit. However, if the dependent goes out and gets the tax credit, you don't have to actually make that payment. It's only if the full-time employee goes out and gets that tax credit. So you would potentially pay that payment. Does that answer your question?
Okay, now you said, yes, that does. You
Okay.
said earlier in the slides that there's a 50 employee minimum, but I was reading somewhere that all companies were going to be required under this Affordable Care Act to cover employees if they worked more than 30 hours. Is that kind of an either or?
That's not true.
Okay.
And as the Supreme Court said in June of 2012, this law does not require you to offer health insurance. It gives you a choice. Once you hit that 50 full-time equivalent employee threshold, at that point you can choose to either offer affordable coverage to 95% of your employees and their dependents, or potentially pay that employer shared responsibility payment. And I say potentially because one of your employees has to actually go out there and actually get a tax credit. So let's say you've got these 50 employees. You offer this insurance to them, but none of them take it because they're all married and they all get covered by their spouse's insurance. Or let's say you have an older workforce and they all are on Medicare, right? In those scenarios, they're not going to be purchasing it on the individual marketplace and getting that tax credit, so you won't actually end up paying anything. Does that make sense?
Mm-hmm. Yes, it does.
Okay.
And I think that's it for me. I think most of the questions that I have that our broker can figure out.
Yeah, exactly. I think a lot of folks are going to be in your same situation. They're just going to say, let's let the broker figure it out.
Thank you.
Yep.
I think we have time for one more question. There's a woman that has her hand up for a while. Can we go to her? Linda?
Hi, I was just wondering if you have 50 or less unless you have 49 or less employees, you do not have to cover any health insurance, right?
That is correct.
Okay.
Great. Well, thank you very much, Linda. I know there's several questions, and I know we're over on time. So what we're going to do is open it up. We're going to make the presentation available. It'll be on IAPMO's website. And also, if you have those attending the webinar, if you have specific questions you'd like me to forward on to SBA, my email address is Dain, D-A-I-N, .Hansen, H-A-N-S-E-N, @IAPMO.org. Send me any questions you have, and I will compile them into one document and forward them over and get questions from the SBA, and then we can make those Q&As also available on our website and get back to you that way. And again, most of the questions that we're seeing in writing is if we can get a copy of the presentation, and again, yes, we will make that available for everyone that needs it on our website. And with that, thank you very much, Julie, for your time, and we appreciate your input.
I'm glad that we could help you out. And again, if you guys have any questions, definitely check out our website. Send emails to Dain with your questions, and we'll try to get back to you as soon as possible with the answers.
Thank you so much, everybody, and thanks again, Julie.
No problem. Take care.
Bye-bye.